going to do it in English, okay? Muy buenas noches, aquí el doctor Dra Reyes con Advanced Physical Medicine y como todos los jueves aquí tenemos un testimonio nuevamente, pero en esta vez lo vamos a hacer en inglés. Bueno, un poquito de inglés y medio español, un poquito de Spanish, ¿verdad? Aquí tenemos a Andrés, buenas noches.
Thank you so much for having me.
Oh, you're welcome, you're welcome. So, today we have a patient that we liked his story so much because he is a patient for two different cases, okay? So at the beginning, he came here because you had a knee complaint, a knee pain, right?
Yeah, I had a knee injury because I do like a lot of jogging, a lot of physical activity, so it was like a lot of inflammation. So it was just something that was bothering me, so I seeked out care, and I found the practice, and it was really good, and I liked it.
Okay, so just going to elaborate a little bit more about the knee that he had, right? So the knee, he is a jogger, so jogging, you know, people that like to jog and run, a lot of times they do complain about ankle pain and knee pain. And in his case, he was more a patient, not for the chiropractic, it was more for Tammy, right? The nurse practitioner?
Yes.
So he was more in the medical side. In the medical side, he was seeing her for the knee, and then she provided some injections, and then great results, right? You had
It was really good. The injections, you know, with Tammy was just, it was simple. She just said, you know, like, let's work together in doing it. She injected it, and it really helped with like the popping and like the inflammation, and I had like more movement and more range of motion.
So great, thank you for that. So I'm gonna talk about a little bit about the knee and inflammation. I don't know if Rafa, this can be seen from over there, but I'm gonna get closer then. So this is a knee. This is a knee. So in here we have we call a meniscus. So the knee joint, which is a joint, is a space between two bones that are together. So a lot of times when we run, right, we run, all these ligaments, they do move, and sometimes it does get inflamed. And the inflammation can affect the entire joint, and sometimes with the ligament, they do move around. Patients start complaining about a popping noise. That's what you were.
It's super weird. It's like it'll just like crack,
cracking and popping, and that is okay. Once your knee, I mean, for example, if a joint can be moved, right, but you hear pops, it's okay, all right. What is a problem if you have pain, which you had, or you cannot, the range of motion, you cannot perform it. For example, if you cannot extend your knee completely and flex it completely, that was going to be an issue. But again, your issue was that you had pain. So inflammation was attacking his knee joint, and then so Tammy was able to, fix it, right, or treat it, and then that was resolved.
It definitely relieved a lot of it. Like, it wasn't like a lot of noise, a lot of like, it was more fluid, I would say. So, because like the whole range of motion is correct. Like, it was inflamed, so it would just have to be like there. But once like with the injections and stuff, I was able to just like move it more, and it was just more comfortable.
Okay, great. And then, so that was a great story. And then what happened afterwards?
Afterwards, I had a car accident.
Okay,
and,
this is the sad part.
Yeah, you know, I had a car accident, and it definitely like it just exacerbated that. I did also get like some back pain and some shoulder pain, so it was. I came out here to seek more care, but it was definitely an experience. Like,
yeah. So again, in life, I want to say thank you for trusting us about your health, because a lot of times patients, they do come for something, but then when they have an auto accident, sometimes they do forget that in advanced physical medicine, we treat patients with accident cases, okay?
Right. The practice was super good. They were able to just be so versatile and like work with the knee and also the back issues that happened from the accident. And it was a lot of like patient care, a lot of like talking with the staff, and they're just great.
Yeah. So we are going to talk about a little bit more about your back pain, because one of the number one complaints about somebody that is involved in auto accident is neck and low back. So definitely the spine. So something that I want to like you to share, because sometimes people that they're not able, they never been to chiropractor, they don't even know what a chiropractor does. Sometimes they think that we're jumping people's back, right?
Right.
And then so tell us about a little bit about the experience between you and Dr. Roman, which is the doctor here, about the explanation, and then how you felt. Do you feel comfortable?
Yeah, I was definitely comfortable. It was different than what I thought it was gonna be. Like, I thought it was like the table where you wrap the person and you just flip them over, and then we just like there, and I was like, oh, okay, that's different. But I was very comfortable with him, able to ask him the questions. He went very in depth about the issue, and just he gave me a result. He gave me exercises. He gave me technique on how to fix it, and I feel like that's what was the best. I feel like the knowledge that he gave was just incredible.
Okay, so I'm going to try to translate a little bit here for what we have talked so far. So, buenas noches. Aquí, en el caso de esta noche, estamos hablando sobre un paciente que vino con problemas de dolor de rodilla. El paciente pues, se trabajó con el departamento médico, tuvo excelentes resultados, donde el paciente pues, se sintió que ya no, pues, no tenía el problema, ¿verdad? Pero lamentablemente, tiempo después, tuvo un accidente de auto, y entonces él pues pensó, oye, yo me atendí por esto, pues me voy a atender allá de nuevo. Entonces ahora en el caso es una condición nueva para el paciente, y en el caso de la espalda baja, pues no tiene conocimiento de qué es lo que hace un quiropráctico. Yo pensaba que el paciente uno lo agarra en una mesa, lo viera patas arriba, ¿verdad? Pero no era nada de eso. Entonces el doctor Román, que es el doctor quiropráctico en esta oficina el 100% del tiempo, él fue bien educativo explicándole de qué consiste la espina, por qué es importante trabajarla. Entonces el paciente se sintió bien confiado de que, ok, estoy en un buen lugar. Yeah. So going about your spine, a lot of times people that have auto accident, they get misalignments of their spine where the vertebra moves incorrectly. It stays in an improper position. So where the nerve, they get irritated.
Yeah.
So a lot of times people complain about the back pain because the nerves are irritated. Or they call it the pinching nerve, right?
It's like a pinch in the back.
Yeah, pinch in the back, and you feel the pain that goes down to your leg or goes down to the glute area. So be able to treat this area. Adjustment is not the only one thing that we have to do. So in your case, you were talking to me about the stretches too, right?
Yeah, there was a lot of stretches, a lot of like back relieving. So like I couldn't do here because like you required like the machines and stuff, but it was really good for the back. A lot of tools like a back belt, like a back brace, that was like super great because it was able to just like support the whole area. As well as that, there was it was like a band that you put, and that was really good with posture. So in general, the whole stuff overall is what really attacked everything and just made it better.
Okay, right. I'm going to translate that. Okay, so he's experiencing what we call it a combination of passive therapy, active therapy, chiropractic care, all combined, and also manual therapy. Manual therapy, we call it in our world where we treat the muscle that needs to be treated. Okay, because you can go to a massage place, right, and they're treating you your whole body. But really, they're not attacking the area where you need to work. So in this case, you were injured. So the therapist will work on the muscle specifically, and then Michael, which is one of our therapists, he was stretching you in the area that you say, oh my gosh, you're hitting the spot, right?
Yeah, Michael was really good with the technique. Like he was able to like adjust and just be like, all right. He showed me the exercise the way it had to be done. So like it was really good with like just like the rehabilitation.
Yeah. So in here when we do active therapy, which is physical therapy or exercises, we have somebody supervising, so telling you, correcting you, like fixing you. Hey, no, do it this way, do it that way. Because in the spine, what we want to protect is the integrity of the alignment and also your muscles. You have to have a balance of your musculature. So sometimes some days you may feel that your spine was weaker on this side and stronger on the other side.
Definitely.
So stretching is very, very key. It's a big key about your care. And then also the traction therapy where they pull your spine.
Yeah, the adjustments. Yeah, the adjustments were great. Like they really helped with just like stretching it all out.
So in this case, tell me a little bit about the noise that you hear after an adjustment, because that's it. I mean, people go online. Oh my God, they do these followers and they want to hear the cracking noise, right? But tell us a little bit about our experience about the cracking.
It's super weird. Like when you first walk in, I was like, okay, I'm scared. Like I don't know what's happening. Are you sure you're doing it right? It's like a pressure, like a lot of pressure, and then once you hear like it's super weird. Like I was scared the first time. I had anxiety. Like the whole 20 minutes of that, I was like, wait, are you doing it? He was like, you're fine, breathe. Like he walked me through that process because like it's just like a lot. So once he explains to you like, hey, the pressure, that's what we're gonna crack, and then once that goes, the relief, you're gonna be fine. Yeah. Literally, the adjustments were the best thing for me.
Thank you. So a lot of times patients are so scared about the adjustment, and a lot of times they just start, they see they see a video and they get scared and they do, well, I don't want to do that. But in this case, Dr. Roman, he was able to explain you, and even though after the adjustment, you still feel, you're like, oh my gosh,
yeah,
you kind of freaked out a little bit, right?
Oh, I had the most anxiety right afterwards. I was like, yeah.
So in this case, he was able to calm the patient down. That this is completely okay. It's completely natural. It's your own body. Be able to get in line, and then the noise is secondary, right? But then we humans, we tend to associate everything, right? So then some people get addicted to that. The adjustment, by the way, doesn't have to make noises all the time. So sometimes, if you don't hear the noise, oh doctor, do it a little harder because they didn't make the noise.
That's so 100%, because now I come back and I'm just like, am I getting adjusted today? Because the relief is just amazing. Like, you have no idea.
Yeah. So then, so when you hear that crack or pop, and you feel like a release, like an instantaneous release of that pressure.
Yeah.
And so thank you for sharing that, because a lot of people are out there complaining about back pain, and they're thinking about going to a chiropractor. At least you're hearing somebody that never had it done before, and it came because he had a good experience about his knee experience, and now his back is doing a lot better. And now also your shoulder, also the adjustment of the shoulder.
The adjustment of the shoulder was also something that really helped, and then the exercises in general of the shoulder, like with Michael, and the technique was everything. Once you learn the technique and he gave you all the tools, you really had everything to prosper.
Yeah, wow. And then one question that I have for you, right? So I talked to you a little bit before we went live. So in here in the office, where they were like very informative about you trying to control your own condition, right? And they're telling you, oh, you're responsible for your health, so we want to help you to be able to achieve those. That's why they gave you a belt. The belt, you're going to spend more time at your work, at home, than here. Right. So we wanted to make sure your back is protected whenever you're doing like sweeping, mopping, or whatever you do at home. Right. So I was telling him that, our main goal here in Advanced Physical Medicine is like, we want to create this healthcare system where, in my opinion, has been lost for a few years, where people are living in a sick care system, right? Okay. People go to the doctors only when they're sick, and then not go to the doctors just to stay healthy. So, and I was telling our patient here that you're responsible for your own health, and then nobody's going to take care more than yourself.
Right. And you guys definitely give people the tools to be able to help yourself. Like I said, the back brace was super good for me. The exercises and the technique stuff was the way that it was shown. It was amazing. And then they have this one thing. It was like a spray, like an ice spray, and that was really good. So
there you go, the spray. So the spray is not like a one of those sprays that you can buy, over the counter. It's a natural spray where it has natural anti-inflammatory ingredients that you can, you can use it on yourself. So we promote most everything that is most natural as possible. So we don't only treat like joint pain, but we treat also people that have a lot of headaches and neck pain and all that. And the chiropractic, it just it is part of that umbrella that helps patients like like yourself. Now, would you recommend somebody to go and take pain medication first, or seek chiropractic care?
I mean, once I realized what it was, and it wasn't, you're going to put me on a table and flip me over, I was like, okay, fine, this is different. Let's try something new, something more like natural, like holistic. That was, something more holistic, non-medication. It really worked. It really did.
Okay, great. Because I was telling him, I kind of put him in the spot right there, but I was telling him, what, our main goal in this office is just to anybody that suffers from chronic pain, to get them out of pain so they can stay out of pain. But also, from my deepest, from the bottom of my heart, what I wanted to avoid is patients that are complaining about pain and they're staying at home taking medications. And the medications, they do treat the symptom, right? And I'm not taking that away because they do treat the symptom. But if you're taking the pain medication, your pain does, after the effect of the medication, your pain comes back, you have to search for something different. Okay, and then pain medication has taken many people's lives because of the abuse of it, right? So we want to avoid that. And then in here in Advanced Physical Medicine, we have 3 offices. For those that are new, in this live Facebook, we have one office in Kissimmee, close to Poinciana, one in Hunters Creek, and here that we are in the 700 Boulevard, close to the airport in Orlando. So If you're suffering from pain, chronic or acute, or just had an injury, please reach out. You can reach out to our page here on Facebook. You can message us in private or call us on our cell phone. We have a phone line that can answer the phones after hours. So 407-282-3615, and then or message us. We're here to help as many people we can. Okay, and then also, how do you heard about us?
I had started out through Facebook. I had known you. You have like a really big page and really big following, and I look a lot at the reviews and just amazing reviews. So friendly, so patient oriented, and then just made me want to come.
Yeah. So we have a patient that came through our social media, and then those are don't know us, and then you're looking at this video for the first time. Just say hello, say hi. We want to talk to you, get to know you, and then any question you may have about health is either just to improve your health, your life, your overall health, hormones, pain, you name it. We could probably have an answer. Okay, so. Rafa, do we have any questions? All right. So those that are out there at home, thank you for being with us, and then we'll see you next Thursday. Don't go away. I'm going to say a few things in Spanish. So, buenas noches. Yo sé que tú hicimos el video más en inglés que en español, pero hemos tenido un buen testimonio en el día de hoy. Gracias por haber venido. La experiencia que él ha tenido con su primera vez y después que tuvo un accidente de auto, pensó primeramente en nosotros y ha tenido buenos resultados a través del tratamiento de su espalda, su cuello, su hombro. El staff, él habla muy bien del staff de nosotros, incluso que él conoció de la oficina a través de nuestra página, pero él no se atendió ni conmigo ni con la doctora Pichardo, se atendió con el doctor Román y con Michael y con todo el staff que está aquí en la Semoran, y él ha tenido buenísimos resultados. Él le encanta estar aquí. Y él quiere referir más pacientes a todas las personas que él conoce y dice, hey, vayan para allá, que ellos me han ayudado muchísimo. Bueno, si es la primera vez que nos está sintonizando, doctor Reyes de la Physical Medicine, si tiene algún problema de dolor crónico o dolor que acaba de ocurrir, o tuviste un accidente de auto, un accidente una caída en tu casa, un sitio de deporte, mire, llámenos o nos envías un mensaje en privado, que con mucho honor y mucho gusto se lo contestaremos. ¿Okay? Bueno, esto ha sido por esta noche. Muchas bendiciones. Hasta la próxima. Chao.